Good morning and welcome. This is Antimicrobial Resistant Talk, or AMR Talk in short, where we're bridging gaps and sharing solutions with you. This podcast is an initiative by the AMR Research and Work on Innovation and Sustainable Solutions, also known as the AMRWISE research group from University Malaya. Our aim is to increase awareness on antimicrobial resistance. So, the news is constantly buzzing about the health challenges mankind is facing, from climate change to mental illness and disease outbreak. The list is endless. AMR is an ongoing problem causing an impact to not just health, but in terms of economy, environment, and many more. In this podcast, we will be talking about the A to Z's of the AMR, uncovering it every step of the way. WHO, or the World Health Organization, defines antimicrobial resistance as something that occurs when bacteria, parasites, virus, or fungi, they change over time and they no longer respond to medication. So, as an effect, it is harder to treat and increases the risk of disease spread and severe illness as well as death. In this episode today, we will be discussing about the basics of AMR, also known now as the silent pandemic, where antimicrobials no longer work for many serious infections. There is a lack of awareness of how dangerous this could be. We have with us here today Professor Sasheela from an infectious disease physician from the Faculty of Medicine in UM, whose area of expertise is in infectious and communicable diseases. She's going to help us shed some light about this pressing issue on antimicrobial resistance. Thank you for joining us today, Professor.
Thank you for having me, Shruti. It's such an honor and pleasure to be here today with you to talk about this very important topic.
Okay, so let's start off with, can you tell us what is AMR?
Well, just as you have mentioned earlier, so antimicrobial resistance is when any bacteria, virus, or any other pathogen becomes resistant to the either antibiotics or antiviral or other drugs that previously they could be killed by it, but now they're not effective anymore. And how this occurs is our body has got a lot of bacteria living on us. They live symbiotically, they're known as colonizers, and they don't actually cause any infections. But when we take an antibiotics, what happens is, for any reason, if you take an antibiotics, that antibiotics will go and kill all the sensitive organisms in our body. And finally, only the resistant ones are left behind. And these resistant ones will multiply, and they will become the predominant organisms in our body. And finally, when we do get an infection, we will be infected by a multi-drug resistant organism. Sometimes most of the times the resistance occurs due to mutation. When they are exposed to a certain drug, they mutate to build defenses against this drug so that they can survive. But some of the times now, what happens is a lot of these genetic elements that carry information about resistance can jump from one bug to another, and making antimicrobial resistance happen more rapidly. So in a gist, that's what antimicrobial resistance is about.
Thank you for explaining that. Based on your experience, could you tell us or explain more about your work that you've done, or what have you uncovered while you were working on antimicrobial resistance?
Well, as you know, I'm a clinician and I'm an infectious disease clinician. So I deal with patients with infections, and one of the most common infections that we deal with is infections due to multi-drug resistant organisms. So these can be infections of pneumonia. It can be due to a surgical site infection. It can be due to a urinary tract infection. All these infections are caused by bacteria usually. It could be E. coli, it could be Klebsiella, it could be Pseudomonas. Previously, these organisms were easy to treat with the common drugs that we use. Unfortunately, now, because of resistance, we don't have effective antibiotics for a lot of these bugs that are causing these infections. And that has been devastating for us, because many times patients have had to lose their limbs because we couldn't treat a bone infection. Sometimes they even die if we don't have an antibiotic to treat them anymore, and due to bacterial infections, bloodstream infections, and this can be devastating for a clinician to watch a patient die and to watch the family members suffer.
Yeah, it is scary. As I was reading, going through research, I found a lot of stories where people just die from minor infections, and it's quite saddening to hear this happening. And that's why I understand antimicrobial resistance is a global health threat. So could you tell us more about that?
So, yeah, it's a global health threat just because, unlike human beings, the bacteria and the viruses don't need visas and passport to go from one country to another. They can just be on a human or an animal, even birds, and fly across borders and bring it from one place to another. So we are not in isolation. This is something we share, just like the COVID pandemic, how it spread from one country to another. And similarly, antimicrobial resistance is doing the same, but at a slower rate, just because of the nature of how it emerges. But eventually, it would become a huge global problem. And that's why we say that, these infections, if it happens in one country, can affect another country, just like we saw resistance from one organism start in one country and then spread to another country, just like the COVID. AMR is still the same. The other thing is these infections are very difficult to treat, as I told you earlier. The drugs that we use for them are more toxic. They need IV antibiotics, and there's no oral options for most of them. Therefore, patients stay in the hospital longer, and sometimes patients just go back home because there's no more options for them to treat, and these all can be sources of infections.
Yeah. So, do you think people do not understand how severe this is, or do they have a lack of awareness, which then causes or increases a lot of misconceptions within the community or within even understanding for what AMR is?
Yeah, unfortunately, there is a lot of misconception about antimicrobial resistance, how it occurs, and how to prevent it among the public, as well as healthcare workers, unfortunately. If you ask me, one of the commonest misconception is that antibiotics work for all infections. People are not aware that most of the infections that we actually, minor infections or the common infections that we face, for example, upper respiratory tract infection and diarrheal diseases, are mainly viral in nature. And these antibiotics don't work on this. All you need to do is rest, take a lot of fluids, and maybe some vitamins, and you'll be fine. Unfortunately, lots of people think antibiotics is a quick fix, but what they don't realize is it's not doing anything, but it's actually increasing the resistance in their body. When they do get a bacterial infection, then they're in trouble. There was a study nationally done that showed that 2/3 of the people will actually demand for an antibiotic from their GPs or their healthcare professionals. And unfortunately, there's also a survey that shows that these healthcare professionals would succumb to these demands and give the antibiotics to their patients, even though they felt it was not the right thing to do. And in fact, in a recent survey, it showed that many of these patients were wanted to be treated for even fevers, which is most likely due to dengue. In a short audit that we did in our hospital, we found that 70% of the patients who were admitted for severe dengue had already been on an antibiotic before.
Oh, wow.
And dengue is a viral infection, and antibiotic does not do anything. The most important thing is taking a lot of fluids. So, in fact, a national survey in 2020 showed that 1 in 3 people claim that they do request from their doctors that they want an antibiotics, and 2/3 of them perceived that an antibiotic would work for anything. So, I think this is a true evidence that there's significant lack of awareness among our public. So that is one great misconception. I think the other misconception is people feel that if there's a bug on their body, they immediately need to be treated. They don't understand there's a concept called colonizer versus infection.
Could you tell us more about colonizer versus infection?
Yeah, so thanks for asking that question. So people need to be aware that our body, as I told you earlier, has got organisms living on us. In fact, it's known that we have more bugs on us than cells, human cells, and these bugs actually do good things and help us out. But when we take an antibiotics for something, it completely wipes out all the good bugs. So when someone goes to get, for example, I'll give, if a patient who has diabetes goes to the clinic to get their diabetic medicine, the doctors usually would check the urine for protein to see whether they have got any proteinuria for kidney micro damage. But unfortunately, most of these strips also pick up bacteria, and some of the urine will show bacteria positive. But that doesn't mean anything, because it just could mean that the sample was not taken well, or the bacteria is one of our colonizers in our body. But the patient is absolutely well. There's no symptoms at all. And when a doctor sees that bacteria, or when the patient sees the bacteria in there, they demand for an antibiotic. So I think these are some of the things that leads to overuse or misuse of antibiotics. And it's very important for a clinician to decide when to treat a patient when they see these organisms. It is usually based on signs and symptoms. It's based on the site of infection, whether the organism is coming from a sterile site like the blood, or a non-sterile site like the urine. And also it depends on what bug we're treating. So it's important for both the healthcare professional and the patient to have some knowledge about this, and also for healthcare workers to take some time to explain to patients about this concept and why they're not being given an antibiotic upfront, to improve awareness on all parties.
So would you say that these could be some factors that would result in antibiotic resistance among people?
Yeah, definitely. I mean, if someone continues to demand for antibiotics and takes the antibiotics, and healthcare workers continuously give these antibiotics, it will definitely propagate resistance. Yeah.
So are there any more factors that you could elaborate or explain a bit more on?
Yeah. So the other way that antimicrobial resistance happens is due to poor infection control. So if the antibiotics selects out resistance and causes the emergence of resistance, but if you have poor infection control, if you don't wash your hands properly, whether you're a healthcare worker or from the public, you will tend to spread these multi-drug resistant organisms. So it's very important that we practice good infection control measures, whether in the public arena or healthcare workers in the hospital, taking proper protocols to prevent a hospital-acquired infection. The other thing is, of course, the use of antibiotics in animal health, in agriculture, also can lead to antimicrobial resistance, as human, animal, and environmental health is all interconnected. And the use of antibiotics in any one of these sectors will have a detrimental effect on all three.
Yeah, so one would affect the other, and vice versa. It's a cycle.
Yeah, exactly.
So what about some strategies and approaches? Because I'm sure there are a lot of people doing research. They're undergoing studies to see how we can prevent this from happening.
Yeah. So there's actually a lot of strategies globally and locally that have been done. In fact, in May of 2015, at the 68th World Health Organization or Assembly, recognized the importance of this antimicrobial resistance as a public health threat. And they came up, adopted the Global Action Plan. And this Global Action Plan, the main purpose is to put in interventions to control antimicrobial resistance, which includes reducing unnecessary antimicrobial use in humans as well as animal. And they took it as a global action plan to emphasize the importance of cross-sectional interventions. And that's what is known as the One Health approach. So controlling antimicrobial resistance in animals, humans, as well as the environment. And since then, WHO has encouraged countries all around the world to come up with their own national action plan. And in Malaysia, in 2018, we launched our first National Action Plan against Antimicrobial Resistance, or MyAPAMR. It's a 5-year action plan on antimicrobial resistance, and it's been launched to prevent it in our country. And our second one will be launched at our at World Antimicrobial Resistant Awareness Week launch. So we all look forward to our renewed national action plan. So this national action plan in Malaysia is jointly developed by the agencies under the Ministry of Health and Agriculture, Agro-based Ministry, and it plans to aim and promote rational use of antibiotics or antimicrobials in both human and animal sector. So I would say the aim of this National Action Plan for all agencies, not only for human health but animal health, is to improve the regulation of use of antibiotics in infection control. So we don't want unnecessary antibiotic use even in animal health, only when they're sick, but not for prophylaxis or preventing an infection, or even as growth promoters is not allowed. And also not to use antibiotics that are important in human health in animals as well, and to control that. It is also to promote responsible antibiotic use and among doctors, public, farmers and vets and everyone else involved in antibiotic use, improve surveillance on the emergence and spread of antimicrobial use, and there be sharing of data among regions as well, which is very important to understand what is happening, and encouraging research and development of new antibiotics and alternative therapies to combat antimicrobial resistance. So hopefully with all these interventions, we can increase awareness of antimicrobial resistance and put in strategies for in all sectors. And of course, animal and the partnership with civil society organizations is also very important in all this.
Wow, that's very interesting. How important do you think is interdisciplinary research, or even as a general, how important do you think it is to conduct research, to come up with more ideas, to more prevention strategies in terms of combating AMR?
Yeah, I think, we've always worked in silo, and that's not going to work. We always think we do research in humans to just prevent infections or treat humans. We do, research in animals, in an environment. It all happens in silo. But we are beginning to realize that one affects the other, or not beginning to be. Now, there's a lot of data that's showing it. So I feel that, now research should be more from bench to bedside, or I should say, we should be able to use all our research in a real life sort of scenario. It shouldn't be just done as a research for publication, but we should translate all our research that we do either in human and translate all this into real life scenarios. And it should, and whatever research we do, we should try to incorporate all this and not just say, what is the benefit to only one population, but whatever research we do, we should try to make it a One Health approach.
Benefits everyone.
Because as you can see, if it affects one category, it's going to affect the other one anyway. So you have to work that way from now on. So if you ask me, it's very important to work this way.
Okay, I agree. I think that's a good approach as well.
Yeah.
So where do you foresee, or what do you foresee for humanity, or even mankind or animal, the environment as a whole, if we lose control to fight for AMR?
Well, it's actually quite bad. Actually, there was a modeling study done by the Wellcome Trust in 2014, and they showed that if we do not take any action today, by 2050, AMR will kill 10 million people.
Wow.
And that will be more than cancers, actually. And most of these cases, unfortunately, will be from Asia. So I think it is very, very close to us. And we really need to work hard to improve things. Because one of the other things that we face is, there's no new antibiotics coming up. But even when new antibiotics come up, the accessibility to this
is limited.
It's limited. And as a physician, this is very, very devastating. We see the end product of it, and it's a very gruesome sort of vision that we have of everything. So I think we really need to work together. I think we need to work, build awareness, and people should realize to prevent antimicrobial resistance is everybody's responsibility. And as you mentioned earlier, this is a silent pandemic. Silent pandemic meaning that it's growing and growing very softly but slowly,
Yep.
unlike what COVID did. But eventually, if we do not catch up with the antimicrobials or take action to reduce antimicrobial resistance, we would face a very, very challenging situation. As I said, I'm already seeing patients who need to chop off their legs and are dying just like they had it in the pre-antibiotic era. So I think, I think we really need to work hard on this.
Let's hope we can all work together, take a step forward towards fighting against AMR or antimicrobial resistance. Thank you very much for sharing your thoughts with us today. That was Professor Sasheela, infection disease physician from University Malaya. It was a pleasure to have you here with us today.
It was a pleasure being here. Thank you very much for having me.
Okay. This has been the first episode of the AMRWISE podcast series brought to you by University Malaya. I am your host, Shruti, and AMRWISE was created by UM and produced by UM. So to learn more about us, please visit our website as mentioned below. Thank you for listening, and please join us and stay tuned for our next episode. This podcast is supported by a grant from the Foundation to Prevent Antibiotic Resistance. Thank you so much.